If you were to become ill, what might you expect from the NHS? Good clinical care, of course, but what else can the NHS provide? What about the buildings we ask people to visit? What about the land around them?
Over recent years, there's been an increasing body of research which has looked at the impact of green exercise on health and well-being. And there's now compelling evidence that that improves not only our physical health, but also our emotional and mental health as well. One of the really interesting pieces of research that I came across was actually for even people who were stuck in a hospital bed, if they were able to connect with the outdoors through a kind of good view from their window, showed that actually the recovery times from operations and their use of analgesics and painkillers was very much less.
In response to this growing body of evidence, the NHS Green Space Demonstration Project was established. The project's aims are to explore the options in terms of greening the NHS outdoor estate and to mainstream this thinking across the healthcare sector. With pilot projects already established in many area health boards, the NHS Green Space Demonstration Project shows how high-quality, accessible green space can promote positive health outcomes for a range of groups. Patients are already benefiting.
We have several groups that use the garden throughout the week. These include amputee patients who are going through a process of rehabilitation, user groups such as Dundee Association for Mental Health or the Maggie Centre. We get a lot of referrals as well from occupational therapists, from medical practices and from organisations such as Employment Support.
Stress can play a major part in a cardiac patient's life, and using the green space can help alleviate that.
This initiative isn't only about therapeutic care though. NHS staff are also benefiting from good quality, accessible green space.
You have various woodland walks. Some can take 15 minutes, some can take half an hour. You know, this one you could run in your lunch break. This one, if you're going to a meeting, you could walk through that. It's all about really trying to transport you and trying to take you away.
It's just fantastic because it means if I'm having a day full of meetings, I can nip out and disappear into the woodland for 10 minutes just to clear my head.
The demonstration project is also about providing a green exercise destination to our local communities.
Postle Park is one of the most deprived communities in Scotland, and we were really keen to invest both in terms of the new health centre but also in terms of the environment. It's quite a harsh environment, and we were really keen to kind of support the development of this community growing space here.
Across the demonstration project, collaboration between the healthcare and environment sectors has brought additional expertise into the management of the outdoor estate.
We in estates and facilities and capital planning have professional expertise, but perhaps not always in the external environment. We do grounds and gardens very well, but when it comes to that master planning, when it comes to the biodiversity, the principles that are involved, it's good to have the experts there.
The NHS Green Space Demonstration Project is also showing how greening the outdoor estate can assist with some of the wider challenges facing the healthcare sector in Scotland. Green space can provide valuable cooling effects for buildings and people, improve air quality around hospitals, and store water, reducing the risk of flooding. An increased understanding of the impact of external design can also result in expensive problems being avoided.
We know that our buildings are being designed to be far more airtight, but the downside of that is the solar gain that we're experiencing and the build-up of temperatures that we're having in nigh on every new build across the NHS Scotland. We've now got evidence that shows for every £1 that we spend on green space, we're actually realising over £4 of social and economic benefits from the wider range of sustainability gains.
The NHS Green Space Demonstration Project has shown what can be achieved to enhance the outdoor estate at relatively low cost. But to achieve real change, we need to apply this thinking across the healthcare sector. Together, we can make places which are nurturing of positive health, well-being and resilience.
Across Scotland we have a wonderful health facilities estate that sits right in the heart of communities, and I would like to see much more opportunity being exploited to promote those facilities for this type of purpose.
Our vision for the future is that green space is built into every investment decision, every new development, every refurbishment across NHS Scotland. For climate change, for biodiversity, but also for the health of our people.